Welcome back, everybody, to another deep dive. We love to really dig into interesting topics, and today we're going to be diving deep into pharmacy careers for individuals with autism. We found a great article called Exploring Pharmacist Jobs for Individuals with Autism: Types, Pros, and Cons, and it really got us thinking about all the different paths that are out there, and you know how someone's strengths and passions can really align with different pharmacy roles.
Yeah, it's fascinating how many different paths there really are. A lot of people, they think of pharmacy and they just think, oh, you're just, counting pills all day.
Yeah.
But it's so much more than that.
Yeah. Okay. So let's start with kind of a classic, the community pharmacist. This is the friendly face you see at your local drugstore or grocery store pharmacy.
Right.
What exactly do they do all day?
Well, I mean, they do dispense medications, of course, but they also play a really vital role in patient care. They answer questions, explain dosages. They provide advice on over-the-counter medications. So there's a lot more to it than just, handing over a bottle of pills.
Right. And that sounds like a lot of interaction with people. So could this be a good fit for someone on the autism spectrum?
It absolutely could be. When you think about explaining medication instructions, it's a very structured type of interaction. You're providing specific information in a clear and concise way. And for some individuals on the spectrum, that can actually be quite comfortable. And it's also a fantastic way to build communication skills in a safe environment.
That's a great point. And the article mentioned that community pharmacists often manage health screenings too. So what exactly does that involve?
Yeah, things like blood pressure checks, cholesterol screenings, even flu shots. So it's a way for pharmacists to play a more proactive role in preventative care.
So you've got routine, you've got variety, you've got this direct patient interaction. Sounds like a pretty well-rounded role. But, the article did mention some potential downsides to this role. What did you think about those?
Well, it's important to be realistic. Um, Retail pharmacies can be very fast-paced, sometimes even chaotic. There might be long lines, frustrated customers, ringing phones, all happening at once. And for someone with sensory sensitivities, that could be a real challenge.
Right, I can see how that would be very overwhelming. So what are some ways to kind of navigate those sensory challenges? If you're someone who does have those sensitivities, how can you make that work?
Well, noise-canceling headphones, for example, could be a real lifesaver,
Hmm.
especially, during those really busy periods. Some pharmacies might even have designated quiet spaces where employees can take breaks and just kind of decompress for a little bit.
Yeah.
It's all about communicating your needs and finding solutions that work for you.
Right, so it's not one size fits all. It's really about figuring out what works for you. So community pharmacy, potentially a great fit for someone who thrives on that routine and enjoys those structured interactions, but maybe not ideal for those who are highly sensitive to sensory overload. Now let's talk about a clinical pharmacist. This sounds a bit more, well, clinical.
Yeah, it is. Clinical pharmacists typically work in hospitals or healthcare systems, and they often specialize in a specific area. So that might be oncology, which focuses on cancer treatment,
Yeah.
or the ICU, which is the intensive care unit.
Wow. Those are some pretty high stakes environments. So what kind of work do clinical pharmacists do in those settings?
They work very closely with doctors and nurses to optimize medication therapy for patients. So that means making sure patients are getting the right medications at the right dosages and monitoring for any potential drug interactions or side effects.
So it's a very collaborative role.
Absolutely. They're part of a larger healthcare team,
Yeah.
all working together to ensure the best possible outcome for the patient.
That sounds incredibly rewarding, knowing that you're having this direct impact on patient care. But the article did mention that the hospital environment can be very unpredictable.
Right.
So how might that kind of unpredictability affect someone on the autism spectrum?
Well, hospital settings, especially in areas like the ICU, are constantly changing. Patient needs can shift rapidly. Emergencies can happen at any moment. And you might have to adjust your schedule or your tasks kind of on the fly. And for someone who really thrives on predictability, that lack of routine could be difficult.
I can see that. So are there any ways to kind of manage that unpredictability?
Well, clear communication and a supportive team are key.
Mm.
If your colleagues know that you prefer to have, a clear plan for the day, they can help you stay informed about any changes or any unexpected situations.
Okay, so that open communication is really, really important. So clinical pharmacy, high impact, collaborative, intellectually stimulating, but potentially challenging for those who really crave that predictability and routine. All right, what's next on our pharmacy quest here?
Let's shift gears and talk about compounding pharmacists. This is where it gets really interesting. Imagine being a medication detective. You're creating custom medications for individual patients.
Ooh, that sounds intriguing. Tell me more about what compounding pharmacists actually do.
Well, they take existing medications and alter them. So they might change the dosage form or add flavorings. Or they might even create entirely new formulations to meet very specific patient needs.
So why would someone need a customized medication?
Well, there are a few reasons. Someone might have allergies to certain ingredients in commercially available medications. Or a child might need a medication in liquid form because they can't swallow pills. So compounding allows pharmacists to really tailor medications to those individual needs.
That's incredible. It sounds like compounding pharmacists need to be very detail-oriented and have strong problem-solving skills. Would you say that those are common strengths for individuals on the autism spectrum?
Absolutely. When you think about it, measuring out precise amounts of ingredients following specific formulas, ensuring that final product is safe and effective, all of those tasks require meticulous attention to detail. And when it comes to problem solving, compounding pharmacists are constantly analyzing patient needs, considering potential interactions, and figuring out creative solutions. It's like a puzzle. And a lot of individuals on the spectrum really excel at those kinds of challenges.
Yeah, I'm starting to see how someone's strengths could really shine in this role. But the article did mention that compounding requires specialized training.
Right.
So what does that involve?
It typically requires additional education and certifications beyond a standard pharmacy degree. You'd need to learn specific techniques and safety protocols for handling and manipulating medications.
So it's not a career path you just kind of stumble into. You really have to be dedicated to it. What about job opportunities? Are compounding pharmacies as common as retail pharmacies?
Not quite. Compounding services are often offered within retail pharmacies.
Wow.
But there are also specialized compounding pharmacies. They may not be as widespread, though, so finding a job might require some extra effort depending on where you live.
Okay, so compounding pharmacy, highly personalized, creative problem solving, and really perfect for those detail-oriented individuals. But it does require that specialized training, and the job opportunities might be a little bit more limited. This is turning out to be quite a journey. What's our final stop on this pharmacy quest?
Let's explore the world of specialty pharmacy.
Okay, what sets this apart from the other pharmacy paths we've discussed?
Specialty pharmacists focus on specific disease states or patient populations. So they might specialize in oncology, like we talked about earlier, or rare diseases, or even areas like infectious diseases or organ transplantation. They become true experts in their chosen field.
So it sounds like you'd really need to have a passion for a particular area of medicine to go down this path.
Absolutely. And you'd be working with patients who are often dealing with very complex and challenging health issues. So empathy and strong communication skills are really crucial.
So how does someone on the autism spectrum kind of navigate those complex social interactions, especially when patients might be experiencing a lot of stress or anxiety?
It's about finding ways to connect that feel authentic and comfortable for you. Some autistic individuals might excel at providing very clear and concise information, which can be incredibly reassuring for patients. Others might be really great at using visual aids or written instructions to help patients understand their treatment plans. And remember, active listening is a very powerful communication tool, even if it's not always verbal.
Those are excellent points. It's about leveraging those unique strengths and finding ways to connect that feel genuine. But like compounding, the article mentioned that specialty pharmacy can be a niche field. So what did it say about the job prospects there?
Well, the availability of jobs often depends on your chosen specialty and your location. If you're very passionate about a specific area, you might need to be willing to relocate to where the demand is.
Okay, so specialty pharmacy, deep expertise, strong patient relationships, but with a niche focus and potentially limited job opportunities in certain areas. Wow, we've covered so much ground already.
I know we have. It's amazing how many different paths there are within pharmacy. Each one has its own unique challenges and rewards.
It's like we've just completed the first leg of our quest here. We've mapped out the terrain, we've explored the different options, and now it's time to dig a little deeper.
Exactly.
So in the next part of our deep dive, let's take a closer look at the strengths that individuals on the autism spectrum can bring to these pharmacy roles.
Right.
I think you'll be surprised by how well suited they can be for this profession.
I think so too.
We'll see you back here for part 2.
Welcome back to our deep dive into pharmacy careers for individuals with autism. In the last part, we really explored different types of pharmacy careers. And now I think it'd be great to kind of delve into the unique strengths that individuals on the autism spectrum often possess and how these can be incredible assets in pharmacy.
I'm ready to be impressed. The article really hinted at these strengths being a real game changer in this field. Where should we start?
One of the most notable strengths is a meticulous attention to detail. And this is absolutely crucial in pharmacy where accuracy is paramount.
Right, you're dealing with medications, dosages, potential interactions. It's not a field where you can afford to be careless.
Exactly. And this is where individuals on the spectrum can truly shine. Think about measuring out precise amounts of ingredients for a compounded medication, or double-checking a prescription to ensure the dosage is correct. These are tasks that require unwavering focus and precision, and they often align perfectly with autistic strengths.
So, attention to detail check. The article also mentioned a knack for pattern recognition and problem solving. How do those skills translate to the world of pharmacy?
Let's go back to our example of a compounding pharmacist. They need to analyze a patient's specific needs, consider potential allergies, and then figure out how to formulate a medication that meets those unique requirements. It's a puzzle that requires pattern recognition and problem-solving skills.
I see what you mean. It's like connecting the dots and finding creative solutions within a set of constraints.
Precisely. And those skills are valuable across all areas of pharmacy, from clinical pharmacists analyzing patient data to community pharmacists identifying potential drug interactions. It's about seeing those patterns and applying logical thinking to solve problems.
So far, we've got attention to detail, pattern recognition, problem solving, all amazing skills for a pharmacist. What else should we add to our list?
Well, technology is becoming increasingly important in pharmacy. From electronic health records to automated dispensing systems, pharmacists need to be comfortable navigating these tools.
So does that mean you need to be like a tech whiz to succeed in pharmacy these days?
Not necessarily,
Mm.
but a willingness to learn new software and a general comfort with technology can be a huge asset. And getting what? Many individuals on the spectrum have a natural affinity for technology. They often enjoy exploring new systems and figuring out how things work.
That makes sense. So tech savviness, another plus. But what about the social interaction aspect of pharmacy? The article touched on this as both a potential challenge and a unique strength.
Right.
Can you elaborate on that a bit?
Absolutely. It's important to remember that autism is a spectrum, and everyone's experience with social interaction is different. Some autistic individuals might find frequent social contact overwhelming, while others might enjoy those interactions but need clear communication guidelines to feel comfortable.
So how do we kind of balance the need for clear communication with the reality of working in a fast-paced environment like a pharmacy?
It's all about finding the right strategies and support systems. For example, a community pharmacist could use visual aids or written instructions to supplement their verbal explanations, especially when patients might be feeling anxious or overwhelmed.
I like that idea. It's about meeting people where they are and using different communication tools to make sure everyone feels understood.
Exactly. And for those who thrive on routine and predictability, the structured nature of many pharmacy tasks can actually be a real advantage. Think about the routine of filling prescriptions or the step-by-step process of compounding a medication. Those predictable workflows can create a sense of comfort and stability.
It's like those strengths and preferences actually align with the demands of the job. That's fascinating.
It is. And let's not forget about the incredible value of honesty and integrity. Individuals on the spectrum are often known for their straightforward communication and unwavering commitment to doing what's right.
Those are invaluable qualities in any profession, but especially in healthcare, where trust is paramount.
Absolutely. So to recap, we've talked about attention to detail, pattern recognition, problem solving, tech savviness, and unique approaches to communication. All incredible assets in pharmacy. And let's not forget those core values of honesty and integrity, which are so essential in this field.
Yeah, I'm starting to see why the article was so optimistic about the potential for individuals on the autism spectrum to thrive in these pharmacy careers. But it did acknowledge that, there are also challenges to consider.
That's right. No job is without its challenges, and it's important to be realistic about those as well. The article mentioned sensory overload as a potential concern.
Right. I can imagine that the sights, sounds, even smells of a pharmacy could be overwhelming for someone with sensory sensitivities.
Exactly. The bright fluorescent lights,
Hmm.
the constant beeping of machines, the strong smell of medications. These are all potential triggers for sensory overload. And in a busy retail pharmacy, there's also the added challenge of dealing with crowds and noise from customers.
So what can be done to kind of mitigate those sensory challenges?
Well, self-awareness is key. Knowing your own triggers and limits is the first step. Then it's about communicating those needs to your employer or colleagues and working together to find solutions.
So what are some examples of those solutions?
Well, noise-canceling headphones could be a lifesaver in a noisy environment. Some individuals might benefit from taking regular breaks in a designated quiet space. Others might prefer to work in a specific area of the pharmacy, perhaps away from the hustle and bustle of the front counter.
So it's about finding those accommodations that allow individuals to perform their best without feeling overwhelmed or stressed.
Precisely. And remember, communication is key. Don't be afraid to advocate for your needs and explain how certain accommodations can help you succeed in your role. Most employers are willing to work with their employees to create a supportive and inclusive work environment.
That makes me think about social anxiety that some individuals on the spectrum might experience. How can we kind of address those challenges?
Again, it's about open communication and finding strategies that work for the individual. Some people might find it helpful to have a script for common interactions, like greeting customers or answering basic questions. Others might prefer to communicate primarily through email or written notes.
Is it about finding ways to kind of structure those interactions and reduce that potential anxiety?
Exactly. And for those who thrive in more solitary environments, there are pharmacy roles that involve less direct patient interaction. Remember, we talked about compounding pharmacists and clinical pharmacists, who often work more behind the scenes.
That's a great point. It's about finding the right fit based on those individual strengths and preferences. So we've covered the strengths that individuals on the autism spectrum can bring to pharmacy, and we've talked about some of the potential challenges that they might face. What's next on our deep dive?
We've talked a lot about how individuals can advocate for themselves. But what about the pharmacy profession as a whole? How can we make this field more welcoming and supportive of neurodiversity? That's what we'll explore in the final part of our deep dive.
Welcome back to the deep dive. We've explored these different pharmacy career paths, and, we've talked about the unique strengths that someone on the autism spectrum might bring to the table. But now I want to shift our focus to the bigger picture. How can the field of pharmacy itself become more inclusive and supportive of neurodiversity?
Yeah, it's a crucial question. The article really emphasizes the need for a two-way street. Individuals advocating for themselves, yes, yes, but also the pharmacy profession taking proactive steps to welcome and support neurodiversity.
So it's not just about, individuals adapting to the existing workplace. It's about the workplace adapting to embrace those individuals.
Exactly. It's about recognizing that neurodiversity is not a deficit. It's a different way of thinking and experiencing the world. And those different perspectives can actually be incredibly valuable in a field like pharmacy.
The article mentions sharing experiences and insights as a starting point. What does that look like in practice?
Well, imagine, autistic pharmacists sharing their stories, both the challenges they've faced and the triumphs they've achieved. Those stories can help break down stereotypes and create a better understanding of what it's actually like to be an autistic professional in this field.
It's about normalizing those experiences and showing that, autistic individuals can be incredibly successful in these pharmacy careers.
Precisely. And sharing those insights can also open up conversations about accommodations. For example, an autistic pharmacist might talk about how clear communication protocols or designated quiet spaces have been helpful for them.
And that could lead to those accommodations becoming more commonplace, so it benefits everyone in the workplace, not just those on the spectrum.
Exactly. It's about creating a more inclusive environment overall. And the article even suggests, advocating for changes within pharmacy schools to better prepare future pharmacists to work with neurodiverse colleagues.
That's a fantastic idea, starting early, to foster that understanding and collaboration from the ground up. So if someone's listening to this and they're thinking, okay, this all sounds great, but how can I make a difference? What would you say?
Well, there's so many ways to contribute, no matter where you are in your journey. Connecting with other autistic pharmacists, either online or in person, can be a huge source of support and shared knowledge. It's about finding that community of people who get it.
Right. I can imagine how valuable that would be, to feel seen and understood by others who share those similar experiences.
Absolutely. And if you're already working in pharmacy, you can be an advocate within your own workplace, suggesting accommodations, educating colleagues about neurodiversity, or even just being open about your own experiences can make a real difference.
It's about being that voice for change, showing by example that neurodiversity is a strength, not a weakness. The article also mentioned the power of sharing your story more broadly, maybe starting a blog or speaking at events.
All right, that's a great way to raise awareness and reach a wider audience. You never know who you might inspire or what conversations you might spark. There are also organizations that are dedicated to promoting neurodiversity in healthcare. So connecting with those groups can amplify your impact.
So it's a multi-pronged approach. building community advocating within your workplace and sharing your story to raise awareness. And all of those efforts contribute to creating a more inclusive and supportive field of pharmacy.
Exactly. It's a collective effort. Imagine a future where pharmacy welcomes and celebrates the unique skills and talents of everyone, regardless of neurodiversity.
That's a future worth striving for. And I think our deep dive today has given you, our listener, a fantastic starting point for exploring this path.
We've covered a lot of ground, from specific career options to broader issues of inclusion and advocacy. But the most important questions are personal. What sparks your interest? What kind of environment do you thrive in? And what unique skills and perspectives can you bring to the world of pharmacy?
Those are the questions to ponder as you continue your journey. We've given you the map, but you get to choose the destination and chart your own course.
The article ends with a powerful call to action. Sharing experiences and insights can foster greater inclusion and understanding. So we leave you with this. What will your contribution be? How will you help shape the future of pharmacy?
That's all the time we have for today's deep dive, but we hope this has sparked some ideas and inspiration. Be sure to check out the show notes for links to the article and other resources. And join us next time for another deep dive into a fascinating topic. Until then, keep learning, keep exploring, and keep the conversation going.